I was having a lot of back pain and a lot of burning sensation in my abdomen. So I went in to see my GI doctor because she didn't think it was related to my colon at all. So she recommended just getting a CT scan of my lower abdomen. So that very next day, she got me in. So I took the CT, which was on a Friday. That Sunday, we actually left for vacation. That Monday morning, she calls to let me know that they found some lesions on my spine. I said, lesions? What are you talking about, lesions? So she continued on to tell me what they thought it was, which was either going to be multiple myeloma or metastatic bone cancer. We didn't feel like being on vacation no more, so I ended up just renting a car and driving all the way back to Bismarck.
For lymphoma and leukemia, more commonly, we need to think about intravenous treatments. Often those are based on chemotherapy. For acute leukemia, that's more of a serious diagnosis where we need to act fairly quickly, and it's a more intense treatment. Patients often need to be hospitalized, and that can be for weeks to even up to a month or more. And then transplantation is a key component of the treatment of many of these blood cancers. Probably talking about 6 to 8 weeks for that whole process. For an allogeneic transplant, it can be much longer. Even when they go home, they still need to come back frequently for visits. Well, there are multiple issues. It almost overwhelms me at times just to see what patients go through, and also the courage with which they rise to the occasion to deal with this. But they're away from home. They have to find housing. They are not working during this time, so there can be loss of income. They can't come here alone. It's best if they have a family member or a good friend or someone to be a caregiver for them, so that it can add an additional burden on the family. Being away from loved ones is a challenge.
He was telling us it's going to be a 6-week stay in Rochester for a stem cell transplant. And yeah, both of us were thinking in the back of our minds, where are we going to stay? Because we knew the transplant house wasn't going to work for us because we have a family. Of course, we started searching and looking and, finding apartments that were pretty expensive, So Cassie remembered during one of our visits with a person at Mayo that she recommended calling the Med City Foundation.
When Christina called, I looked at my phone and I thought, 507, it's not another good phone call, I didn't expect any good phone calls because I hadn't had any for a long time. So I thought, this can't be good. I cried through that whole call. The amount of stress that you feel when you go through this is immense. Just this thought of losing somebody that you love to who cares about how much it costs, to thinking that there's people who care and want to help. What Christina did in taking, it's like stress and levels. And that day was just like, whew. They have relieved a level of stress that wasn't able to be done in any other way. I mean,
one of the biggest changes that I've seen with the assistance that we're giving now with Med City Foundation compared to 4 years ago when I was sitting at my kitchen table thinking about this idea is that patients are really telling us what they need help with, and we're meeting that need wherever it is for them. Sometimes that means helping them to find a place to stay. Sometimes it's helping them with car repairs, helping to clean their home. Other times it's making sure that they have holiday gifts for their entire family when they've already told their kids there may not be any. Whatever those needs are, we want to be able to be there to meet that need. Our challenge right now is that there are more patients coming to town every single day for treatment, and we need to find a way to also continue to grow as an organization to make sure that we're keeping up with that need. We don't want to turn patients away, and we want to be able to continue to provide a high level of service when they need it.
we can run benefits, we can do anything else, but just know that there are people out there who care, that they had no idea who we were, and to call me, yeah, it was a huge blessing to know that there are people out there who care.